My name is Julie Mead, as she shared. I'm currently Chief Officer of Special Services in Caldwell School District. I most recently came, I was the director of Idaho SESTA, which is special education support and technical assistance funded by the State Department of Education. And then I did a brief stint for about 6 months with Debbie Critchfield and her team as the director of special education for the state of Idaho. And now I'm happy as a clam to be back in my home district. I also am a school psychologist, which is where I started. So just a little bit about me. Go ahead and go to the next slide. So what I've been asked to do is really kind of give a really high level overview of special education and Section 504 plans and how those things intersect and how it just sort of the big picture. We could really spend a full year of courses on each of these topics and still not scratch the surface. So understand that I'm going to be giving you a really high level understanding of what they are, the purposes, and how they relate to each other. So we're going to kind of get to know the very key components of IDEA, key components of Section 504, and that third bullet was for another session that I supported. So go ahead and go to the next slide. Okay. So when we talk about special education, that is actually the law that governs that. The federal law is the Individuals with Disabilities Education Act, IDEA. The purpose of IDEA is that it makes free, appropriate public education available to students with disabilities. You might hear that called FAPE. That's a term that we use quite a bit. And it provides special education and related services to eligible students, which is a very generic way to describe actually some very, very specific set, a very specific set of laws. But next slide. The other federal law that we're going to be talking about is Section 504. So you may have heard of things like a 504 plan in the school system. And that refers to Section 504 of the Rehabilitation Act. And it ultimately is an anti-discrimination law, which, as you could read here, says that no student shall be excluded, denied the benefits of, be subject to discrimination. And it includes academic instruction, non-academic services, extracurricular activities, those sports clubs, different field trips, et cetera, or any other services provided by a school district because of the impact of their disability. So Section 504 is much broader in scope in that it's not IDEA specifically provides a very specific type of set of services to certain individuals with disabilities. And Section 504 is much broader, where it catches everybody and says, yeah, we have to serve students in such a way that their disability doesn't ultimately result in discrimination in the school system. Next slide. Here's how they fit. It's how they relate to each other. So there is, we got all the students in the school, in the district. This is public school, of course, is the big umbrella. And then you have students who may have physical or mental impairments that maybe don't reach the standard that we're going to be talking about for being eligible under Section 504. And then that next circle is Section 504, students who are eligible for that. And then the smallest circle in that is IDEA, so special education. So all students who are eligible under IDEA are also protected by Section 504 protections, non-discrimination protections. But not all students who are eligible under Section 504 are eligible under IDEA for special education and related services. So that's how those fit. Next slide. Here's some things that they both have in common. What's interesting and notable is that they both have these things in common. Under IDEA, these concepts are very explicitly laid out. Under Section 504, it's very, very limited language. And so these concepts have come from federal guidance around how Section 504 works in schools, and it really actually closely mirrors in some ways IDEA requirements, a little bit different, but similar. Child Find is ultimately the district's active obligation to identify students and children who may have disabilities and may either require protections under Section 504 or special education or related services. So we have obligations to actively seek that. That might look like we have preschool screenings. It also might look like a lot of our intervention systems, RTI, you may have heard of, response to intervention, things like that, where we are ultimately intervening and kind of identifying which students may need that level of support and have a disability. Free appropriate public education, again, there's that concept of FAPE, that every student ultimately is entitled to education that's free, publicly funded, appropriate, which is the quick way of saying is that's sort of determined by the student's IEP or 504 team about what's appropriate for that student. Public, again, at public expense, and education. And education is actually typically defined as what does your state law define as what an education is in your state, core subjects, et cetera. Least restrictive environment is, it's a really important concept for both Section 504 and IDEA. And it says that students with disabilities must be educated with students who do not have disabilities to the maximum extent appropriate and possible. It's a bit of a soapbox topic for me, so I will not go off on my soapbox right now. But it's critically important, and the students have the right, essentially, that we should be starting with serving students in general education with their non-disabled peers first, apply interventions to those systems, and then determine if removal from the general education environment is necessary to do that as minimally as possible. So students with disabilities are educated with their non-disabled peers as much as possible. Both IDEA and Section 504 have a set of procedural safeguards. It's much, much, much more complex in IDEA than it is in Section 504. But essentially, these are the rights that parents and adult students have in terms of due process, grievance processes, the rights, to call and attend meetings and all those different things. So procedural safeguards at IDEA that we hand to our parents at IEP meetings is like, I don't know, 30 pages long. And for 504, it's a page. So again, in IDEA is much more detailed. And then manifestation determination, both there's rights to manifestation determination, meaning if there is a disciplinary action that's going to result in a change of placement, which that's its own big topic. A team has to determine whether or not the behavior is a result of the disability. And if so, there's a much different path that schools have to take. So you often hear folks say that you can't discipline students with disabilities. That's not true. You absolutely can, but students with disabilities do have particular rights. And districts have obligations that if we know that a student has a disability that's resulting in some of these disciplinary infractions, we have the obligation to make sure that we've addressed those things through a functional behavior assessment and a behavior intervention plan. Quick note in the comments, somebody asked about getting a one-on-one BI. That again, that's another big topic. Is that less restrictive? It depends. It really depends, because what I think happens inappropriately often is that we put a one-on-one with a student, but we fail to actually implement a behavior plan that ultimately looks at fading the support. So it can be much more restrictive. And it also can be really helpful, but you really have to have a good plan in place for it to be considered less restrictive. And then both IDEA and Section 504 cover, they have due process rights for parents. Next slide. Team membership. So again, this is a place where there's similarities in the sense of IDEA has very specific requirements. The parent or adult student is a mandatory team member, a general education representative or teacher, a special education teacher, which in the case of some students that are just the speech language pathologist would fill that role. District representative, which usually looks like a principal. Sometimes it's people like me. And then it's required to have experts qualified to interpret assessment results. So for example, if we have given an academic achievement assessment, we need to make sure that somebody at that table can talk about what those means. Or if somebody's given a cognitive assessment, then we need to make sure the school psychologist is at the table to interpret those. Section 504 team membership it's at the regulations say it's a group of knowledgeable people. It's not well defined in all of the guidance around the regulations. It essentially says you'd be best served to kind of follow the guidelines under IDEA. So if you meet IDEA's criteria, you'll definitely be in line for Section 504. So schools typically operate this way, that they typically have a very similar team composition for Section 504. Next slide. And I apologize. I know I'm skimming through this really fast, but I want to make sure we get you at least a bite out of the big picture. Eligibility is an important thing to know about, especially for folks who maybe don't work in the school systems. This is where there's quite a big difference. Under IDEA in Idaho, we talk about the 3 prongs. So under IDEA, the first thing is that you have to have a disability that is very specifically defined in one of the 14 eligibility categories that we'll show in the next slide. The criteria for those is very specific in each area. And there's a very specific outlined evaluation procedure in the schools. The second prong, though, is that we have a lot of students who may meet that criteria of prong 1. The additional criteria that have to be met for under IDEA is, does that then have an adverse impact on the student's educational performance? And is there a need for specially designed instruction? So in some cases, we have a student with a disability who maybe even there's an adverse effect, but that we are able to serve appropriately either through a Section 504 plan or in the general education environment through sort of interventions. So the students with the most substantial needs would be identified under IDEA. There are a lot of situations. So let me switch to Section 504, and then I'm going to answer that question in the chat because that's an important question for this group. Under Section 504, we're asking the question essentially: does the student have a disability as defined by Section 504, which we'll talk about? And does the disability or disabilities substantially limit a major life activity or major bodily function? Which is very broad, and it's intentionally broad. They will, any guidance that you read will tell you that Section 504 guidelines are intentionally very broad to ensure that we don't unintentionally leave folks out of that those protections that are allowed. The question that came up in the chat was, when would a child with autism not qualify for an IEP under category of ASD? A lot of my patients qualify under OHI rather than ASD. That's a great question. It's not the question I thought you were asking, but okay. The team can choose. I mean, at the end of the day, if there's more than one category that the student fits under of the 14, then the team essentially identifies the primary one. That doesn't mean that that the team doesn't acknowledge the others. My practice as a school psychologist and in schools is typically that if a student has autism, I generally see that that's sort of the overarching disability that really, I don't want to say catches the other disabilities, but some of these other things that we're seeing are likely a result of autism rather than something else. I'd have to go case by case to understand why folks are choosing OHI. It could possibly be because maybe schools feel more comfortable going with, oh yes, thank you, OHI is other health impaired, which a lot of times is ADHD. Not always, because students with seizure disorders, those kinds of things would be under health impairment. So maybe schools feel more comfortable understanding what one of those is versus the other. In my practice, typically I would identify ASD in those cases. Next slide. So just really quickly, these are the 14 disability categories under IDEA. They do in some way or another catch pretty much everything. But again, under IDEA, a student would have to meet very specific criteria for each of these, for one of these or more, to be identified for IDEA. And then we'd have to answer the questions of, is there an adverse effect and is there a need for specially designed instruction? Next slide. I specifically am sharing, this is the straight out of IDEA, the definition of autism spectrum disorder from IDEA. IDEA was most recently updated in 2004, so this does not change with the DSM-5 or the DSM, whatever changes those are. But this has sort of the general overview. It doesn't go into the depths about levels and severity and those kinds of things. Because in the school system, we are allowed to do what's called an educational determination of autism, which is not a formal diagnosis. You all have to do that. But these are the characteristics we would be looking for. Next slide. And then this is the other part that these are this is the sort of the outline of the criteria. That the evaluation has been conducted as it's supposed to, that they have a developmental disability evident in early developmental period. It is a requirement that for schools that even if you all have diagnosed it on our school team, a school psychologist must be a member of the team, and a speech language pathologist must be a member of the team. So that's that. If we receive a diagnosis from a clinician or outside of the school system, a team is obligated to consider it, meaning that it's not an automatic you're eligible for special education, but the team must consider it and document it and make decisions one way or another based on that information. But it's not necessarily a slam dunk for special education eligibility, because you have to meet those other two prongs. There are a lot of students who have autism, as you all know, who are somewhat, really relatively functional in the school system. So they may not need the level of specially designed instruction, but may need some accommodations and things, supports in the classroom, which Section 504 would cover. Yeah, absolutely. It's really, really important that we are able to get information from clinical folks, doctors and psychologists, et cetera. The process for an educational determination is that the school psychologist, speech language pathologist would be involved. Many school psychologists are formally trained in things like the Ed.S. Some are not. And so what they would be doing is essentially making a case for that the student, that those criteria that are outlined in that first slide are potentially true of the student. And then we need to make sure that we have enough information. We don't want not having a clinical diagnosis to keep a student from being able to be served if they need to be served. But it's not a formal diagnosis. So then we also encourage folks, like, there's other supports and things in the community that you also need to be accessing. Next slide. A 504 disability, again, we're going to go much more broad. It essentially says a student with a disability, basically it's somebody who has a physical or mental impairment, and there's no specific definition for what that is, which substantially limits one or more life activities, or they have a record of such impairment, or they're regarded as having such an impairment. So under Section 504, we're looking at students that, we don't have to have a formal diagnosis of anything, and there's not really specific criteria. It's like, hey, what do we know about this student? Are they even regarded as, have we been addressing the student, treating the student, serving the student as though they do have a disability that would qualify as a disability under Section 504? Next slide. And the criteria of substantial impairment, there's no formal definition. So substantial impairment is really determined by the team. Next slide. This is the list of some of the major life activities. Again, it's not intended to be all-inclusive. It's intended to be extremely broad. In schools, it's very common for us to kind of want to make a connection to specific things like emotional regulation, regulating impulses, executive function, general things like that. So we might actually narrow it down to something like that. Next slide. And a major bodily function. So again, they are intentionally broad, and they are intended to catch students just to ensure that we're not missing a student who could potentially be facing discrimination based on a disability. Next slide. So with the Section 504, there's a few things. One is that you might go through this and discover that student's not eligible, there's no disability, or there's a physical or mental impairment, but no substantial impact. Option 2 is that there are students who are eligible for protection under Section 504 because there's a disability that with a substantial impact of a major life activity, but Right now, a formal plan isn't needed. And then the third is the eligible and they may need a Section 504 plan. I'm going to answer a couple questions in the chat. What would I recommend that parent do to advocate for an IEP for their child? Yeah, I mean, the first thing that you do is that you go, if you suspect your student needs special education, you go to the school and you make a formal request. You simply say, I would like to have my child evaluated for an IEP. Here's what you need to know about that, though, parents, is that doesn't guarantee that your child will be evaluated. It guarantees that a referral meeting will happen with the team, with you present, should you choose to be present. That's up to you. Where the team will determine whether an evaluation is warranted. But the minute you sort of make that request, excuse me, they have 10 days to respond to that. There should be some sort of referral meeting. A decision should be made about whether or not to evaluate. And if the answer is to not evaluate, you will get written notice indicating the reasons why. Same thing goes for 504, really. And I've heard from many parents that ECE evaluations will not be completed by child school until after they're 3 years old. Yeah, I mean, we don't serve students in school districts until they're 3. We do evaluate students younger than 3, but typically that is students who are coming from infant toddler program from Department of Health and Welfare. There's really no reason schools can't start to evaluate a bit younger than 3. It isn't a typical practice, but it's not necessarily forbidden. I mean, it is appropriate in some cases. No, the school cannot complete a referral meeting and not invite the parents. And I will say, just from my previous experience at the state level, this is a misunderstood concept by teams. They're not doing it on purpose to be mean, but referral process has been a little bit shaky. So the actual rules around the referral to consider a special education evaluation is what it's called. It's required at that point, the entire team members, the required team membership applies. You should receive procedural safeguards from the school, and a meeting isn't required, but they are required to ask you if you'd like to have a meeting. So if they're having a referral meeting that you're not present at and you want it to be, they've missed a step there. Yes, in writing is helpful. It doesn't have to be in writing. The district's child find obligation is that they need to be listening for things that might trigger that parents don't need to know to say IEP in order to be able to request that their child needs help. If they say, I think my student has a disability, those kinds of things, it would trigger child find either for 504 or IDEA or both. In writing helps because then the team knows what they're coming to the table prepared to discuss. Like, oh, they're concerned about this or that. They'll bring their concerns, they'll bring data, you make a decision together. Next slide. I know we're coming. Oh, good. We made it through the overview. What other questions can I answer for anybody? Yeah, so if in terms of the age 3, so if a student is connected to the infant toddler program through the Department of Health and Welfare, so that is actually Part C of IDEA. It is part of IDEA that the Individuals with Disabilities Education Act starts from birth to age 21. Birth to age 3 is covered by Part C, which is the infant toddler program in Idaho. Part B is kindergarten through age 21. So if you are in Part C through infant toddler, then we are obligated to have evaluated and determined whether you need and have an IEP in place by the time you're 3 years old. So for those students who have already been identified, that transition should be seamless. It's a little bit different, when folks are calling. I don't see a reason why you couldn't evaluate somebody who's going to be 3 in 2 months. Some of the assessments that folks do maybe aren't normed for that age level, but in most cases they are.